Hi, I'm Dr. Andrew Walter. I'm an OBGYN hospitalist here in Tampa, Florida for Women's Care Florida. Today I wanted to talk with you a little bit about what an OBGYN hospitalist is, because there's still a lot of confusion from both patients and doctors what we are and what we do. First, I was born and raised in Fort Wayne, Indiana, trained in Philadelphia at the Medical Center of Albert Einstein, and then I moved to the Tampa Bay area in 2013. So I've been practicing medicine since 2009 at the start of residency, and in the 12 or 13 years or so that I've been practicing, I've delivered thousands and thousands of babies here in Tampa and also in Philadelphia. Being an OBGYN is a very, very busy job, and we deliver lots of babies and do lots of gynecology. But the difference between an OBGYN hospitalist and the typical OBGYN that you're used to seeing is that we are really only in the hospital setting. So in the office setting, you see an OBGYN who manages obstetrical patients, gynecology patients, but is mostly stationed in the office. They'll come to the hospital to do deliveries, they will come to the hospital to do surgeries, but they're always in the office for the most part. When one of our patients shows up at the hospital for any emergency or non-emergency, we are already there. We're in direct communication with your doctors from the office. We have access to your records from the Women's Care platform, and we can get records on any other patient who may show up that we're asked to help with. Having that direct communication and having us always be in-house 24/7, you have direct access to a doctor who already will know most things that we need to know about you and is perfectly suited to take care of you. All of our OBGYN hospitalists are board certified, so they've gone through rigorous training. They've taken the board certification exams for the United States, and they're state certified as well by the individual states. I think one of the great advantages for our patients with the OBGYN hospitalist program is also that more likely than not, you're going to see your primary obstetrical provider at each and every visit in the office. Because in the old way we did things, your OBGYN could easily get called to the office, from the office to the hospital in an emergency and be stuck there for an hour or 2 hours. They might need to do a C-section. They might have 2 deliveries that happen back to back. And then you're stuck either waiting in the waiting room, or maybe you ultimately agree to see a different provider and you don't feel great about that visit because you weren't comfortable seeing somebody new. And that happens a lot because OB is just very busy and unpredictable. With this system, the goal is for you to see your doctor every single time you come to the office, knowing that we, the OBGYN hospitalists, are at the hospital to deal with all of the emergencies, all of the deliveries. If you have questions about which units within women's care have OBGYN hospitalists programs that are available to them, then talk to your doctor, talk to your office manager, and then if you have more questions, of course, they'll be happy to answer that for you.